pubic symphysis, linea alba on the superior part. We make the medial border, the auricular process for the sacrum, the greater sciatic notch, the ischial spine, the lesser sciatic notch, the ischial tuberosity, and the ischiopubic ramus. We make the obturator foramen. Here we make the sacrum, and here we make the sacrotuberous ligament and the sacrospinous ligament. Now, we say linea alba pubic symphysis. Okay, so here linea alba. Then pubic crest pyramidalis. Then pubic tubercle inguinal ligament. Then notch for the artery, vein and nerve. We said that in this you would remember lacunar ligament, corona mortis, lymph node of Clockway, vein, artery and nerve. Then the pectineal eminence, pectineus. Then another notch passing the psoas. Then the anterophiliac spine, iliofemoral ligament and Y-shaped ligament of Bigelow. Then another notch, iliacus and lateral cutaneous nerve of thigh. Then the anterophiliac spine. And this anterophiliac spine ends in the iliac crest. The anterophiliac spine, sartorius and inguinal ligament. So this finishes this part of it. Now we say that there is iliac crest which is convex in the anterior 2/3 and concave in the posterior 1/3. The anterior 2/3 has got 3 lips, the medial, the intermediate and the outer. The outer lip has got a iliac tuberosity. So these are the 3 lips, and you have the transversus abdominis, the internal oblique and the external oblique from the outer lip. The iliac tuberosity gives rise to tensor fasciolata. The posterior 1/3 is divided only into 2. The outer latissimus dorsi, the inner quadratus lumborum. Then we go to the posterior part of it. So this is the iliac crest, posterior superior spine, then the posterior inferior spine, then we have the greater sciatic notch, the ischial spine and the ischial tuberosity, lesser sciatic notch and the ischial tuberosity. Ischial tuberosity, we told you, is divided into upper quadrangular portion and lower triangular portion. Upper quadrangular portion is divided by a diagonal line into lateral and medial. Here it articulates with the sacrum, and therefore we say that this is the this is the sacrotuberous ligament, and here you will see the sacrospinous ligament. On this side would be the acetabulum, and here you will see the head of the femur, the greater trochanter and the lesser trochanter. And here will be the capsule, which capsule will leave the outer portion of the neck free. So I told you the muscle would come from the outer obturator externus foramen and will get attached to the trochanteric crest, passing below the neck of the femur. Correct? Now on this, the most superior muscle that you will see is the muscle coming from here and getting attached here. This is the gluteus medius. Then muscle coming from the anterior surface of the sacrum and getting attached below it is the piriformis. So this is the piriformis. Then muscle coming from the inner surface of the obturator foramen, winding down the lesser tuberosity and getting almost a tendon getting inserted here is the obturator internus. And this is always associated with a superior gemellus and inferior gemellus. And the lowermost muscle which covers the obturator externus is the quadratus femoris. Then muscles from the ischial tuberosity, upper lateral, biceps, lower medial, semimembranosus, semitendinosus. From the lower triangular portion, outer side, adductor magnus, ischialate, inner side, Alcock's canal. What passes through the greater sciatic notch? Greater sciatic notch. Above the piriformis, below, above superior gluteal artery, vein and nerve, below inferior gluteal artery, vein and nerve. Three nerves and pin structures. The three nerves are sciatic, posterior cutaneous nerve of thigh, nerve to quadratus femoris. The pin structures are pudendal nerve, internal pudendal artery, and nerve to obturator internus. These pin structures pass through the Alcock's canal. Pin structures. They lie in the Alcock's canal. And this Alcock's canal is in the anal triangle, lateral to the ischiorectal fossa, and that supplies the anal canal. So this completes the posterior portion. Now, when we come here in the ischiopubic ramus, after the ischial tuberosity, we have three membranes. The perineal membrane, the superior fascia of the perineal diaphragm. This is the deep perineal pouch, and the inferior fascia, which encloses the scrotum and the penis, becomes the Colles fascia, and then becomes the Scarpa's fascia of the abdomen. So this is the superficial perineal pouch, this is the deep perineal pouch. Here you have a ligament the dorsal ligament of penis, on which this lies, and here there is a vein which passes from the penis through the dorsal ligament into the bladder. So if it gets blocked, it will lead to priapism. So we have gone around the pelvis. Correct? Correct?
Yes, sir.
And I hope you remember it.